Resilience, fortitude, hope. These are the words that define the past year at Morehouse School of Medicine. The COVID-19 global pandemic brought unprecedented challenges, and like many organizations across the globe, we were thrust into a time of uncertainty, a time of fear as we watched businesses crumble, unemployment rates skyrocket, and most importantly, loved ones die as a result of this novel virus. But amidst the uncertainty and fears, Morehouse School of Medicine's faculty, staff, and students committed themselves with even greater resolve to our vision and our mission to lead the creation and advancement of health equity. For we uniquely understood that now, more than ever before, the world needs what we do best. Founded to advance primary care, diversify the physician and scientific workforce, and work towards the elimination of health disparities through programs in education, research, and service, Morehouse School of Medicine has been innovating against the devastation and impact of health disparities in minority and underserved populations, as well as addressing the inequities in our healthcare system. So as the events of the past year unfolded, Morehouse School of Medicine stood on the front lines, serving our patients and families and ensuring that they received culturally competent, quality care. We continued to partner with the community to address their needs, from education and awareness about the virus, clinical trials, and of course, vaccines, to navigate this new healthcare landscape. We continue to conduct research that will deliver on the promise of science and medicine, a promise of miracles, but most importantly, a promise really on the quality of life. And above all, we continue to educate and train this next generation of healthcare and research professionals because we know that's what the world needs. So while challenging, this year really affirmed for us the invaluable work that we do every day on behalf of individuals, families, and communities. We remain both proud and determined to do this work. Morehouse School of Medicine is making a difference. We are changing lives, and yes, we are ushering in a more equitable future for all. Our resolve is stronger than ever because we know that the world truly does need what we do best.
Personally, it's been an honor to be the first Associate Dean for Academic Programs and Affiliations. My goal for the office was to really expand our footprint and our mission of health equity. As a result of the pandemic, we had to adapt in the ways in which we collaborate and partner. Despite the challenges, we've experienced a lot of growth this year. We've added members to our team who've helped us achieve missions in Columbus, as well as through our Common Spirit partnership.
Educational Affairs seeks to align our degree programs, our graduate medical education, that is our residencies, and our engagement in the community through educational outreach and pipeline programs to prepare healthcare learners and leaders for the next generation. Back in March 2020, from one day to the next, we knew we had to move from an in-person, high-touch environment to a virtual environment. The faculty were constantly interacting with each other through our electronic devices to change on a dime how we did the educational programs in response to what was the changes that are required to preserve health.
COVID really hit pretty quickly in March, but the institution was really kind of positioned through its continuity plan to really kind of pick up the pieces in terms of facilities, in terms of finance, and in terms of some of the challenges we had in terms of revenue reductions. We did work through it through a budgeting process and a monthly process with the executive leadership team. And we came out 2020 came out well for Morehouse School of Medicine from a financial perspective and even just the operations through COVID. I think overall, I mean, just the transition for students was kind of seamless in terms of going from in-class to online. The facilities really picked up quickly with public safety, et cetera, in terms of moving forward with the things we had to do to keep the campus safe. And through that business continuity plan, we really were prepared to go offline on accounting features such as printing checks, et cetera. So that really kind of did make the difference in 2020 and for succeeding through COVID.
Well, you know, a large part of our patient population that was at risk, you know, as you know, Morehouse School of Medicine also staffs Grady Memorial Hospital here. And our Grady faculty were heavily involved in managing the COVID units. We had to address issues around the graduate medical education and undergraduate medical education to not only keep our students safe, but our residents safe and our faculty safe.
When COVID came about, as one would imagine, it was impactful in all arenas. And research was, of course, one of those. And while we continued our research focus, we did pivot to start addressing the pandemic. Our COVID-19 impact went across the gamut of basic, clinical, and what may be called population research. So actually, our funded increased by twofold during the time of COVID. Because as one would think about it, just as our communities are impacted by health disparities, unfortunately, that was the case with COVID as well. And so where we looked differently at COVID was that we looked to underserved and communities of color because these communities were more readily impacted by COVID. Our populations are already heavily impacted by disparities and inequities. Hence, when COVID came along, that just escalated what our populations were facing. So we were on the forefront in research, just as we were in health. As a matter of fact, Morehouse School of Medicine was among the first minority-serving institutions to be selected as a COVID vaccine trial network.
The Morehouse School of Medicine Center for Maternal Health Equity was established in 2019. There was a need for a center to address the inequities in maternal mortality and maternal morbidity experienced by Black women.
In December of 2020, we announced a partnership with Common Spirit. This partnership with Common Spirit will allow us to send our mission of health equity to communities across the United States that have hospitals affiliated with Common Spirit. The interest and response has been phenomenal. In addition to the impetus caused by the pandemic, we saw a culture shift towards social justice in our country. This presents an opportunity for our learners to learn and grow, train and return to their communities across the country.
We opened a very new clinic on Lee Street, across the street from the medical school. We also are expanding our full-time faculty to deliver care in our new Lee Street location and adding some additional specialties there. We've also added a radiological unit where we can do CT scan and plain film x-rays.
So we were very successful in terms of the landscaping and hardscaping project, which really transformed the outside of the institution. And then from just some of the internal projects, we really did do some space configuration. So we made some relaxation space for students, spaces for when they come back, they can really have some spaces to relax, unwind, and really take care of what they need to do mentally in order to survive a day, month, and year here at Morehouse School of Medicine.
While maternal mortality globally has decreased, maternal mortality in the United States has actually been increasing. The United States has the highest maternal mortality ratio among developed nations. And Black women are disproportionately affected by maternal mortality and maternal morbidity. Black women are 2 to 4 times more likely to experience severe pregnancy complications and die from them compared to white women, and 3.5 times more likely to die than Hispanic women. The Center for Maternal Health Equity's goal is to reduce inequities in maternal mortality and morbidity. And we do this and accomplish this through interprofessional training of our future leaders and current healthcare providers. We do this through interdisciplinary translational research to understand the causes, particularly the root causes, and prevent these inequities from occurring. We do this through community engagement and advocacy, and we do this through innovative, respectful healthcare.
Another, I guess you could say, expansion plan would be that we are looking into adding subspecialty training programs, which also will benefit the community, also benefit the nation, and benefit Georgia, because about 67% of our resident graduates practice in Georgia. So when we expand into the subspecialties, we'll be able to offer different types of specialties that hopefully those doctors will stay in Georgia, as a large part of our primary care doctors have done.
Our convocation is normally a time of excitement and in person when students have their pinning ceremony and receive their white coats. We had a modified version of that for safety, where the students came on campus, but alas, their families were not able to be here. But still, we were constantly adapting so that we could have a high-touch, high-engaged environment to support our learners' achievement. And we were very pleased that we were able to have a modified in-person outside graduation this past year. It was so important for our learners and their families to be able to celebrate after such a long season of changes and transition. During this time frame of the pandemic, recognizing the significant impact on the community we serve, our faculty, staff, and students really stepped to the bat. And as immunizations became available, our students received training in immunization procedures and participated in a variety of immunization drives. We had a Juneteenth celebration and a march for help for Black Lives Matter. And again, we worked through in smaller and larger groups the impact of the tragedies of the past year on our community. There, of course, were the tragic shootings of Asian Americans in Atlanta. And again, we had the opportunity to make sure our Asian Pacific Islander faculty, staff, and students felt included in our focus on health equity for all.
I think the most exciting thing that faces our school is the work that we're doing together and growing the individual faculty and students who begin their career journeys here. It's an opportunity for us to instill in them our values, our love for equity, diversity, equity, inclusion, and to influence a future of healthcare workers who will share that in the communities they serve.
A cornerstone of the Morehouse School of Medicine Center for Maternal Health Equity is our interprofessional training to advance health equity. Our partnership with Goldman Sachs expands these training efforts. We will be creating the second rural maternal health residency program in the country. We'll be expanding our training on cultural competency and implicit bias training with our future learners and other providers. And we'll also be expanding our training efforts around perinatal professionals, including OB navigators. So maternal near miss refers to a condition when a woman nearly dies but survives a severe pregnancy complication during pregnancy, in the postpartum period, or 42 days after termination of pregnancy. And the World Health Organization says that the maternal near miss is a more useful indicator to improve maternal health services. So our project is just focused on empowering Black women and other women of color to tell their near miss stories. And we're doing this through a narrative approach. We know that storytelling in Black and Brown communities is the cornerstone of who we are and how we communicate to one another. And so through this project, we're hoping to understand what causes maternal near misses and use that research to think about solutions to address this issue. Our partnership is with Optum, Reaching Our Sisters Everywhere, and Ladies of Hope Ministries. We want to be known as the preeminent center of excellence that addresses maternal health equity, local, nationally, and globally.
We kind of worked through challenges in the 2020 year, and now we just got to continue to make sure our student base continues to climb like it has in the past, so that will always be something we need to do as an organization, and B, really make sure that we keep our donations coming in. It's very critical for student scholarships and for facility improvements. So all the money that comes through development is critical to our success. And then lastly, it's just making sure that we kind of keep on the growth path with students, and that really helps our bottom line and make sure that we are successful in all we do from the program standpoint.
We're looking for transformational approaches to things. So we're looking at innovation, capacity, and infrastructure building. We're looking for partnerships that allow us to look at a 10-year span of building in an area. One of those areas happens to be genomics. There's so many questions to be asked and answered that are at the level of DNA. And so here at Morehouse School of Medicine, we are looking to build a genomic institute. And once again, this institute will be a conversion of all of those disciplines: basic, clinical, population research will be a part of bringing along this Genomics Institute. And we are fortunate that industries, partners around the country are coming to us wanting to partner with us to address this disorder. Now that's because even though there are many technologies out there, we're looking to get a better understanding of how we can utilize those technologies in our populations.
During this time frame of challenge, our students took the opportunity to engage with the community using electronic modalities. The students developed approaches to outreach that involved phone and other electronic devices to make sure that our community was connected to the best health information and could receive care even in a virtual environment. Our fourth-year MD students were involved in the residency match during their senior year. And of course, this year, because of the pandemic, they could not fly out to do interviews and to actually see the sites where they were going. The faculty guided them through online Zoom experiences and how to do Zoom interviews and supported them in how to assess residencies at a distance. We saw a 25% increase in the applicants to the MD program, as well as a similar increase to our other degree programs. Indeed, nationwide, we've had further outreach by a variety of medical centers networking with us for programs that do relate to diversity, health equity, and dismantling structural racism.
Most importantly, we were able to announce our Common Spirit Partnership, which is at least a 10-year partnership that is going to allow us to double the class size of our MD and our PA students, to advance 5 regional medical campuses around the United States, and 10 graduate medical education programs with no less than 3 disciplines, such that we will increase the training of diverse professionals to at least 300 more per year. And they will disperse around this country to lead the creation and advancement of health equity. So you may have heard that we have announced that I will no longer serve as the president and dean at Morehouse School of Medicine, but only the president and CEO. And we have named a new dean, Dr. Adrienne Tyndall, who will continue to advance our strategy of our academic mission. So one of the things that we want to make sure of is we continue to educate and train those healthcare professionals that the world needs. So our class size expansion, our GME expansion is one of the most important things that we will do. The second thing that's important is that we got to have dollars to pay for those advances. And so I will be out raising money and increasing our partnerships such that we continue to be able to offer a diverse experience for our students, such that they can actually go and practice anywhere in the world and have had experiences that allow them to do that. The third thing is our research portfolio. You will hear about Morehouse School of Medicine advancing its area of research in the area of genomics. We understand that precision medicine and using data and genomics to identify the right drugs and the right treatments for people when they need it and the amount they need to reach their optimal level of health is so important. So you will hear us talk about our research platform in genomics. And of course, you will continue to hear how we will embrace our relationship with the community to make sure that all the decisions that we make are informed by the needs of the community, and that they are not hearing the afterthoughts, but they are there developing the opportunities with us side by side, because everything that we do is about delivering the promise to them.